how do you treat them? How is your approach?
So that's it's very comprehensive to start with. So we spend an hour and a half with patients in the beginning for their first visit, and we get a very comprehensive history. So we want to know how long the patient's been having the pain, exactly where is it located, when does it occur, is it with activity, is it with intercourse, does it occur before or after urination, does it occur with a bowel movement or with constipation, what kinds of things have been done for it in the past, what kinds of either physical therapy or medications have been tried. And then we also want to know their surgical history. Have they had any abdominal history of surgeries or pelvic surgeries, any C-sections, vaginal deliveries? All of these things really get into the history of whether or not, the pain fits into a musculoskeletal type of bucket, a neurologic type of bucket, or say gynecologic, urologic, and we have to kind of put all those things together. So once we have the good history, we do a full exam, and that includes the back, the hips, the abdomen, external perineal exam, and then an internal pelvic floor exam. And on females, that is through the vaginal canal and sometimes rectally. And then males, we use the rectal exam to obtain that information. And then in terms of, what do we do? There's imaging that might need to be done. And in terms of medications, we have a lot of options. If patients are not interested in things like oral medications, which I know a lot of times people are wanting to kind of stay away from, we will use suppository medications with lower side effects and good local muscle relaxation qualities. We'll also use sometimes some injections that will address both tight pelvic floor muscles as well as the neurogenic inflammation in the area. But all of this really is sort of in addition to physical therapy, which all of our patients do go to. And we work really in conjunction with those physical therapists one-on-one, because the patients really can't get better without both. And our treatments, whether it be through a medication or a suppository or an injection, is really in combination with what the patient is doing, both in physical therapy with manual work and exercises, as well as their home program, which I also emphasize to the patients. So it's really a sort of comprehensive approach.